Hi, this is Mohammed Fagir. I'm one of the co-founders and instructors of FRCEM Courses Academy. Today, I would like to talk about important station, which is frequently appearing in both MRCEM and FRCEM OSCE exams, which is lost condom station. So the scenario will be of a lady of childbearing age presenting to the emergency department, stating that she had intercourse and she's concerning that the condom has been lost inside her because they couldn't find it. So your task will be to take history from her, but also to perform a vaginal speculum examination and then formulating a management plan. So it's a three-part task. And the domains here will be examination and clinical reasoning, but also could be of communication as well, and some history. So the history taking, examination, and management plan will be like 30% for each of them, around that. Okay? So once you hear the bell ringing, get inside the station, wash your hands, look around for any clues, and introduce yourself as usual for all stations. And then approach the patient and confirm her name and her date of birth. And then ask her, how can you help her? She's going to explain to you that she had sex and she's concerning the condom has been lost inside her because she couldn't find it. Show empathy at this point and that you are sorry to hear that. And then before proceeding more in your history, make sure she is comfortable. Ask her if she needs any painkillers and if she would like anyone to attend with her. This is really important in this station. And also call for chaperone. Tell her that you are going to call one of the female nurses to attend as a chaperone. All right? And tell her that you are going to ask her some questions which might sound personal, but really important to assess her health, and that will help to evaluate her condition. And that all information she's going to provide will be treated in the strict of confidentiality. So that will provide some assurance to the patient because usually they will be quite anxious. Okay? And then please don't take long history. This is not a sexual history station. And maybe you might need to ask like a few questions, maybe 3 or maximally 4 questions before proceeding and coming back or going to perform the vaginal examination. So I'm going to ask her when this happened, and is there any chance that she might be pregnant at the moment, and when was her last menstrual period, and if she is concerning to have sexually transmitted infections. Because if there is any concern of sexually transmitted infections, then you need to take high vaginal swabs and cervical swabs as well. Most of the time, she's going to tell you that this is her regular partner and she's not concerning of having sexually transmitted infections. Then from this point, immediately go to the second task and tell her that we need to perform a vaginal examination using a speculum. It's called vaginal speculum, and in order to assess for the presence of the condom. And she's gonna, so you need to take consent for that. And explain to her that the procedure should not be painful. However, it's uncomfortable. And if at any point she would like you to stop, then just tell you, all right? And explain to her that after getting the consent, that you will ask her to go behind that curtain and you will find the couch, and she will be accompanied by the female nurse as well, and ask her to go there and first of all, she needs to remove her underwear and to lie down on the couch and cover herself with the bed sheet which is available there, and to lie down supine, and then to bend her legs and separate them apart. And when she is ready, the nurse will call you to come to perform the examination and ask her if she understands what you said, and if that's all right. She's gonna, if you explain that in a very good way and using a good communication skills, then she's gonna accept that and she will do what you requested. Then mention that you would like to wash your hands and to use sterile gloves, and also you would like to bring the new disposable vaginal speculum and lubricate it by using maybe warm water or gel, and go to perform the examination. And mention that you are gonna close the curtain because the privacy of the patient is paramount. Then mention that regarding the vaginal speculum, please have a look or Google it. It's called Cosco speculum. Usually you will make it open it or make the screw loose, and then the handle should be, when you introduce it inside the vagina, the handle of the speculum should point to 3 o'clock, and introduce it until it reaches the cervix, and then turn the handle from 3 o'clock to 12 o'clock, and then open it and secure the screw. And then you need to have a torch as well, a light source, all right. And also you need forceps to remove the condom. So when you have a look inside, usually they will provide you with a pelvic mannequin. So you're not going to do that in a real person, but in a pelvic mannequin, a vaginal pelvic mannequin. So you will find the condom there, remove the condom and show it to the patient, and just dispose it in the bin. All right. We're not going to do any investigations on that condom. All right. And then tell her that you are going to remove the vaginal speculum now. So please don't close it while it's near the cervix, because if you pinch the cervix, that will cause severe pain and might cause injury to the cervix. So you need to bring it out a few centimeters, like 2 centimeters or 3 centimeters, and then release the screw and close it, and then turn the handle from 12 o'clock to the initial 3 o'clock position, and then remove it out of the vagina. So this is how to perform the vaginal speculum examination. And then tell the patient that you have done, and you are gonna go out, and that you are gonna give her some time to clean herself and to put her clothes back, and when she is ready, she can come out to continue your discussion. Please don't stay with the patient while they are getting dressed. This is really not a good behavior. And this is happening in our practice, and unfortunately from some doctors, which is like doing any form of examination, and then once finishing, continuing the discussion with the patient while the patient is exposed, which is unacceptable, because we need to respect the patient dignity. So as I said, I'm going to repeat again. Tell her that you finished your examination, and you are going to give her some time to clean herself and put her dressing clothes back, and ask her to take her time, and when she finishes, then she can come out to continue the discussion. And she will come quickly to you outside in the station. So at that point, as you noticed, you have finished two tasks, which is the initial task of history taking and the vaginal speculum examination. And now we need to formulate the management plan or further plan. So tell her about possibility of getting pregnant, and that offer her to have emergency contraception if she would like. Tell her that we have tablets. If this is less than 72 hours, it's called levonorgestrel, and it's really effective in preventing getting pregnant. Or she might have you might provide her with the coil as well, which is the Cooper IUCD. This is usually effective until 5 days. So we have two modalities for the emergency contraception: the levonorgestrel tablets and the Cooper IUCD. All right. And the other thing is also tell her again, because initially you ask her about possibility of sexually transmitted infections, and now you just touch this issue again. And if she's concerning about having sexually transmitted infections like HIV, hepatitis B or C, if she's confirming that this is her regular partner and she doesn't have any concern, then it's all right. But if there is any concern, then you need to perform that assessment. If she needs PEP, post-exposure prophylaxis for HIV, and also to evaluate hepatitis B vaccination. But usually in this station, there will be no concern. All right. Anyway, offer her follow-up with the sexual health clinic. All right, as an outpatient. At this point, the patient unlikely to have any other concerns, and this is the end of the station. Thank the patient and wash your hands and be ready for the next station. Thank you very much.